So TMJ, oftentimes a manifestation of stress, and in this day and world, we can't avoid that. So we take our time to talk to the patients to try to, first off, look at maybe what the stressors are. From a dental perspective, we may not be able to mitigate those stresses, but certainly we can offer them some modalities of pharmaceuticals, from muscle relaxants to bite splints, massaging of stretching exercises, alleviate the muscle tension or stresses. But we also work very closely with some TMJ specialists if it is something that's more extensive.